Microvascular complications of diabetes mellitus. Diabetes mellitus is a group of disorders which are linked or which are related to impaired glucose metabolism in our body. The microvascular complications of diabetes are diabetic retinopathy, diabetic nephropathy, or diabetic neuropathy. The incidence of blindness in diabetic retinopathy is 25 times more than normal individual. That is, if a person is suffering from diabetes, then he has 25 times more risk of becoming blind compared to a normal person who doesn't have diabetes. Diabetic retinopathy is linked to diabetes mellitus in a way that the severity of diabetic retinopathy is directly proportional to the duration for which the patient has diabetes mellitus. The earliest features of diabetic retinopathy are microaneurysms, and the main layer of retina involved is in the nuclear layer. Diabetic retinopathy is of two types, first being non-proliferative retinopathy and the second is proliferative retinopathy. In non-proliferative retinopathy, the features are of macular edema which can lead to visual loss. After non-proliferative retinopathy, the patient can have proliferative retinopathy in which there is neovascularization and vitreous hemorrhage, which can lead to detachment of retina from its layers and ultimately cause blindness. The treatment of diabetic retinopathy is pan-retinal photocoagulation by ND-YAG laser, or which can be combined with an anti-VEGF drug, which will help to prevent neovascularization, and the example of it is injection of bevacizumab. The second one is diabetic nephropathy. In diabetic nephropathy also there is damage to the vascular endothelium or the glomerular layer part of the kidney, which leads to serial decrease in glomerular filtration rate of the kidney. This also can be regulated or monitored by homocysteine levels or albumin excretion rate or serum creatinine, which can also be called as creatinine clearance. The more is the creatinine clearance, the more is the GFR. So in a way we can use creatinine clearance to estimate the GFR and also the severity of diabetic nephropathy with which it is advancing in the patient. The treatment for it, the diabetic nephropathy, will only be use of dialysis for removing the excretory product from our body. Diabetic nephropathy thus is the most common cause of chronic kidney disease in India or in USA. The third is diabetic neuropathy, and this is the overall most common complication of diabetic mellitus, and this also leads to increased incidence of silent MI in patients because the neural innervations of the heart are also damaged, and this can lead to MI which is not detectable and the patient suddenly collapses. Diabetic neuropathy is so common that it can affect around 50% of the people with diabetic mellitus, and the involvement of nerves are in the sequence that first the sensory nerves are affected, then the motor, and then the autonomic nerve fibers. The features of diabetic neuropathy can also be in form of various ulcers which can occur in our soles because the nerve innervations of the periphery are damaged. Thus, if a patient walks barefoot, he or she cannot notice that he has developed any damage or any injury in her foot or sole, and thus it goes unnoticed, and also there is no pain, so the patient doesn't feel anything, and these in a long term become a non-healing ulcer or neuropathic ulcers. And also, since the patients in diabetes, the patient has decreased immunity, so there is also a bacterial growth around local tissue, and the only treatment for these cases are debridement of the whole area and regular checkup of the area and regular cleaning, so that the ulcers heal on their own. And of also, and for the treatment of pain, we can, if there are, and for all the complications, being it diabetic neuropathy, nephropathy, or retinopathy, the best way to monitor the level of glucose is the level of HbA1c. That is, if the levels of HbA1c are less than 7% per, then we can say that it is a good sugar control. Otherwise, the patient is not having a good control, because the HbA1c level is a retrospective test which can tell you that what is your average sugar level for about 8 to 12 weeks prior to you being tested. So this can help in a lot in telling that what was your average sugar level in your body, so that you can decide that whether you have the adequate level in the body, so that when you are trying to cure a disease, you know that what up to what level I have to decrease my sugar consumption, so that I can have a normal sugar levels and decrease the further progressing of the diseases.